Hello and welcome to Physio Classroom. This is our second video on Mckenzie treatment for neck pain patients. And in this video, we are going to discuss in detail about the second procedure given by Mckenzie to treat neck pain patients. The second treatment procedure for neck pain given by Mckenzie is known as cervical retraction and extension exercise, and this is done in sitting position. Cervical retraction and extension exercise is the progression of the first treatment procedure which was given by Mckenzie. Before starting the exercise, the therapist should record the pain intensity and location of the most distal symptom and also ensure that the patient is seated in upright sitting position. As the name describes, this treatment procedure is a combination of two important movements. The first movement is the cervical retraction movement and the second movement is the cervical extension movement. So when the patient is instructed to do this exercise, both the movements of retraction and extension should appear as a single movement, and the exercise should be done for at least 5 to 15 times in a single session and should be repeated every 1 to 2 hours. So now let's understand the basic kinematics of the cervical extension movement. The normal range of cervical extension is around 70 degrees, out of which the 10 degree occurs at the level of the atlanto-occipital joint. And as the patient goes more and more into extension, the lower cervical spine starts participating into it. So how is it important in prescription of the exercise? So as the patient starts going into extension, the upper cervical spine comes into action, and as the extension range increases, the lower cervical spine also starts participating in the movement. So a lot of time in our clinical practice, we see this thing that when the patient starts doing this movement of retraction and extension, he only utilizes the upper cervical spine movement and he is unable to perform the lower cervical spine extension. This is especially seen in patients who have typical forward neck posture or extension dysfunction in the lower cervical spine. So if you see this patient and this posture, do you think the patient has achieved the complete extension movement? No. Still, the lower cervical extension movement is missing in the action. So the best way to treat the cervical extension dysfunction of the lower cervical spine in such patients is to instruct them to look on either side so that the nose moves about half an inch on either side, and instruct the patient to keep looking upwards and backwards as much as possible. Repeat the movement for 4 to 5 times and then return back to the neutral position. So the cervical retraction and extension exercises can be performed up to the mid-range to treat the upper cervical spine or up to the end range to treat the lower cervical spine. The exercise can also be performed statically by holding the end range position for around 1 minute or dynamically by repeating the movement about 5 to 15 times. Sometimes to gain the further range of cervical extension, it becomes necessary to instruct the patient to give overpressure at the end range of motion. So once we are sure that our patient has learned the exercise correctly, we can instruct him to perform the exercise while standing or while even walking. So cervical retraction and extension exercise is very important in not only correcting the extension dysfunction of the lower cervical spine, but also in arresting the posterior migration of the disc and also helping in reducing the posterior derangement. In our next video, we are going to describe the various modifications of this exercise while performing it in supine or prone lying. Such modifications are necessary for those patients who come to us in their acute phase and are in severe pain. So don't forget to like and share this video. Keep learning, keep sharing, and stay connected.